The LockDown AC device has been in use for 20 years, with many thousands of cases performed across the UK, Europe, Australia, Africa, and the United States each year. The device provides a strong and low-profile construct that is 11mm in width to avoid cutout. The luggage tag fixation avoids bone tunnels in the coracoid, and the single anterior-posterior screw fixation reduces concerns associated with the superior-inferior tunnels in the clavicle. Over the years, the device has been subject to clinical and biomechanical analysis. A number of papers have been published within peer-reviewed journals, including the Shoulder and Elbow, Journal of Orthopaedics, Bone and Joint Journal, and earlier this year in the International Journal of Shoulder and Elbow Surgery. These papers, along with surgeon presentations and technique videos, can be found on our website in the education section. The LockDown acromioclavicular device surgical technique. The patient is placed in a beach chair position. Following incision, dissection, and optional distal clavicle excision, pass the tubular introducer under the base of coracoid in a medial to lateral direction, taking care to keep the tip of the instrument against the bone. The metal leader of the length gauge is then passed through the tubular introducer in the same direction. The introducer is then removed, leaving the length gauge under the coracoid. Next, pass the metal leader through its own loop and tighten to create a lasso around the coracoid. Pass the length gauge in an anterior to posterior direction underneath the clavicle, then position on the anterior surface of the clavicle. Reduce the joint and make note of the required implant size. The double marking indicates an 11cm device. To choose the correct size, the length gauge marking should be positioned centrally on the anterior surface. Pass the length gauge back under the clavicle and carefully unthread the lasso from around the coracoid, still leaving the length gauge under the coracoid. Daisy chain the correctly sized AC device onto the length gauge. To do so, pass the soft loop of the length gauge through the hard loop of the implant, and then open the soft loop out and pass it over the top of the implant. Once the two devices are attached, shuttle into position under the coracoid. Pass the metal leader through the soft loop of the device in order to lasso the device on the coracoid. The implant should be positioned proximally near the native ligaments, and any slack should be removed using the loop tensioner. Pass the leader under the clavicle following the same pathway as before. Reduce the AC joint and position the hard loop over the desired fixation point. Mark this position and then move the device aside. Drill a 2.5mm hole through the clavicle in an anterior to posterior direction at an oblique lateral to medial angle. This is to avoid impingement of the implant by the screw tip. Use a 3.5mm cortical tap to prepare the drill hole. Use the depth gauge to measure the bone tunnel and add 4mm to the measured length to determine the screw length required. This is to account for the hard loop and washer while still ensuring that bicortical fixation will be achieved. Reduce the AC joint, secure the AC device in place, taking care not to over-tighten the screw, and remove the length gauge.